Hello and welcome to another episode of The Untold, the show all about the great people and the stories behind them, their journeys, their experiences, basically their untold stories. I'm Abdullah Al-Hindiani and I'm joined by...
Marzouk Said, and today we have a special guest in the field of dentistry. And the amazing thing, not only him who's like pursuing this field, but also his wife
Yeah.
helping him in this field. Is I think like a combination of motivation when you have someone close to you like your wife supporting you and following you at the same steps.
Yeah, so basically we're going to be interviewing Dr. Sufiyan, who we've had his wife previously on the show, right?
Exactly.
Dr. Saba Anjum. And basically we want to see the difference in their experiences, just to highlight the amount of work and the history behind both of them.
Definitely. So if you want to learn more, and especially if you are a dentist student, then this episode not gonna be important, but it's gonna inspire you to pursue this career. So stay tuned. Welcome back, our dear viewers. We're still continuing our interesting segment with an interesting guest. Usually, when you hear about dentistry, all people think it's only about teeth removal or maybe Hollywood smile, but there is even more to dentistry than that. And that's what our special guest today will talk us more about it. So please welcome with me, Dr. Sufiyan. Welcome to the show.
Thank you so much for having me here. And it's my pleasure to be with you guys and share my thoughts and views about the dentistry and my specialty as well.
Definitely. We didn't mention the specialty part because we
Yes.
want you all to tell us more about
Yes.
it.
Yes. So I'm a prosthodontist by profession. The whole department and the whole specialty is called prosthodontics and implantology. So we deal with something which is missing in the oral cavity and also in the head and neck region. So maybe a patient who comes with a missing tooth, as simple as missing tooth, or a specialty where we deal with accident cases where part of the cheeks, part of the lips are lost, or any cancer patients where part of the face is lost. So we try to replace them and so close and mimic the natural face or the parts with the silicons.
Yeah.
So this goes to a simple tooth replacement to a extent where we replace a part of the face also.
Interesting.
Yes, so this is where whole of the specialty lies.
And I want to go because you've chosen a specialty that's so unique and so, I'd imagine,
Yes.
technical.
Yes.
What made you go into that? Let's go to the beginning. What kind of made you drawn into this kind of field?
Yes, so prosthodont, when during my bachelor training days, so we were taught all the departments. We had a special training for all the departments. So and in the 5th year of our training, I was supposed to be a student editor of the college magazine. College magazine,
Okay.
yes. So in that period of time, what happened? I had to collect all the articles. I had to collect the subject related to all the fields so that I can compile it and put it in the college magazine. So when I was during this process, so I found prosthodontic specialty and implantology specialty. It's something close to my heart where I found out there are so many ways to connect with a person or a patient. So ultimately healthcare, we are there, it's kind of a social service which I call, and it's like doing something good for the patient. No matter, all the departments are equally important, but I chose this because it gives something what the patient has come for. Imagine he has a missing tooth, we replace it, or he wants some enhancing his smile, we do that enhancement of the smile and give back to him. So the person is having a gratitude towards that, and that makes me feel that okay, I have done something good for him or her, and that's why I chose this as my specialty, and I went ahead with the extra 3 years of training in my field.
That's really awesome.
Yes.
And knowing that you could connect with a person not only by chatting and talking, but you
Yes.
actually could connect with them like by helping them when it comes to teeth, like having like a better smile
Yes.
and facing something that
Yes.
regarding that.
Yes.
So
Yes.
talk about connection.
Correct.
I know like during the study time, during university, there are some challenging moments.
Yes.
Who was like your supportive circle?
Yeah, definitely. It was a challenging time because my bachelor's, we spent around 5 years of bachelor's, 3 years of super specialization, and after that, again, the super specialization, what we had done, fellowships and degrees. And so during all this period, it was all a very tedious procedure. Almost 8 to 10 years of our lifetime will be dedicated. Definitely, there will be so many ups and downs. Definitely, after the God and my parents and my family were the support givers, and they would feel happy. My parents and my family, my parents are not from a healthcare background,
Yeah.
so and since childhood I knew that I was supposed to be in a healthcare background person, either in doctor. My mom and dad wanted me to be a doctor. So, and then my aunt was a dentist, so I had some close connection with the dentistry, and then that's why I chose this dental field. And having said that, my family was a biggest support of mine. And after my marriage, my wife is also same specialty, so she's also a prosthodontist and implantologist. And definitely she has been a very great support for me, and whatever I have dreamt have been coming true since the
Yeah.
marriage, and we are working together towards both our common goals as well.
Shout out to the wife. And they say behind every successful man, there's a great woman.
Yes, exactly.
It's like you
Yes.
have your own little competition at the house.
Mm.
You know, you're both driving each other's motivation.
Yes,
Yeah.
exactly. Yes, and every day we keep our personal and professional separately.
Yeah.
But there are few times where we have fixed our time that we will be discussing about the clinic and the patient separately. Only in that time we will be discussing that. Rest of the time we spend time with each other, and
Normal couple.
we have a 18 months old
Yeah.
kid. So
MashaAllah.
we are spending much of the time and giving more time to him as well.
Yeah. And I want to go back to you as a dentist or as a student. So I know for a lot of people, they don't find their true calling or,
Yes.
you know, find joy in what they're doing until later on. Was that the same for you, or when you were studying it, was that when you realized like, oh, I want to do this. I really love this.
Yes. Yeah, during my training period, I have seen professors and mentors. And when I was posted in this department, especially, I would see the my lectures and my seniors who have been done in specialty in this department, and what work they are doing and how they are finding joy in doing that. And I felt something connected to this one. And as I said before, the patient's gratitude is what
Drive
keeps
you.
me driving. Yes, this is I felt that I can connect more with a person, because every patient we see is a different personality.
Exactly.
And every person will come with his or her own expectations, and kind of challenging also. But once we meet up to that challenge and meet up to their expectations, it's no bound for happiness.
Definitely.
Yes.
And of course, like behind like all the patients that you see and encounter, was there like a specific patient that you can recall that comes to you and he wanted to change and then you help him?
Yes. I can recall a couple of patients, but this patient, during my training period, I can tell, there's a young girl. She had cancer of the face here, the cheek part, and the jaw part of the jaw was removed. Jaw and the lips was removed, and she was young as 14 or 15 years of age. And
And you were like in training period?
yeah, during my training
period.
period. Yes.
Wow.
And I was the one who was handling her case here. So once the surgery was done and removed, she came to our department saying that she wants to, definitely, she is very young and she wants to replace this. And I was supposed to be taking care of this patient, and I gave my more than 100% to make sure that she feels good. We replaced her part of the jaw, and ultimately she could chew the food. The joy what after giving the artificial teeth, she chewed her food, and she was very grateful for that. Before that, she was just on a liquid diet. So
Wow.
yes, so that touched me to so much, and that's what keeps me going. So there are
really
many
awesome.
old patients also. Once we give the artificial teeth, they feel happy. They feel like we are getting their age back to around 10 years of age younger
Yeah.
than. So that's something touching.
Not
And
like all superheroes wear cap,
yeah.
actually.
Thank
Some of
you.
them wear aprons.
Yes,
Is that what
yes,
they call it? Apron?
yes,
Yeah.
aprons. Yes.
Yeah.
Thank you.
I want to highlight that, going back to what you said, because a lot of people, think that doctors see 20, 30 patients per day,
Yes.
but each of those is one individual life. Each of
Correct.
those is a person with
Yes,
feelings, and
yes.
you're basically changing the lives
Correct.
of all of those people.
Yes.
So I think that's what you were trying to say, is that, the feeling of gratitude comes
Yes.
with it.
Yes.
Yeah.
Yeah, but not in my case. I don't keep 20 or 30 patients
No,
in
no, I
a
was
day.
saying,
Yeah, I mean, yes. So I'd like to spend as much time as possible with the patient.
yeah.
So maybe my consultation will go for at least around 25 to 30 minutes. And if the patient is comfortable and much of the work to be done and expectations are high, it will last for more than an hour.
Yeah.
So I don't mind spending much time before the treatment, so that I get to know what exactly the patient wants, and so that I can deliver it in a very better way.
Yeah.
So once I get to know everything about the patient, every expectation that he is having, then it makes my work very easy. So I can customize the tooth, or customize the smile, customize the treatment according to that person.
That's really awesome,
Yes.
and such a great achievement, and also like a milestone.
Yes.
So regarding milestone, what other milestone that you're really proud of?
Yes. So apart from my bachelor's and master's, I hold fellowships, board certified prosthodontist, implantologist from GCOI. That's an Italian organization. So I've been recognized as a board member, board certified from GCOI, and we have an academy also. It's called AAPI.
Okay.
It's all about prosthodontics and implantology.
For this specialty.
Yeah, especially we have started an academy. So we train students and we train young doctors. Our specialty, that is prosthodontics and implantology, something which is not taught in the college or in the university. We go a step ahead and we conduct courses and classes for them
Like
also.
give them like a hands-on experience.
Yes, exactly
Very
on
cool.
the artificial models and on the patient also. We are kind of a mentors for them. So this is
wow.
something which I can give back to the dentistry by teaching the students
Yeah.
and the young doctors to be. We want them to learn something new, which is there in the field. So this is something which I am very close to me.
Super
The
cool.
academy which we have done.
And how would
Yes.
you say, because you brought up teaching,
Yes.
how would you say is, teaching as a dentist and then dealing with people? Is there a difference between that and how you address the
Yes, yes.
students? Yeah.
Yes. So teaching was very close to me since my training period. I used to see my lectures and professors teaching. I was more fascinated to that. And most of the things, although universities and colleges teach us, there are few things apart from the textbook knowledge. We are dealing with the patients directly. So this psychological management and the kind of a feel what we have in the patient cannot be taught through the textbook. It has to come with the practical experience. That which I faced a little bit of difficulty during my days, and then over a period of time training under different mentors, I learned that skill. So that skill I want to share it with others. So definitely teaching is a completely different.
Experience.
Yes.
Definitely.
Where I keep myself in their place, because I was
Yeah.
back then I was sitting there listening to my mentors, so I had that mindset also.
That's really awesome. You
Yes.
know, Abdullah, when I used to be a teacher, like English teacher,
Mhm.
one thing I emphasize on to my students is that you have to find your purpose in life. It's
Yeah.
not only like about getting a job and getting paid,
Yes.
but it's about like leaving a mark, leaving a legacy.
Correct.
So stay with us so we can know what is the one thing he will emphasize on. Stay tuned. Hello again, our dear viewers. We're still continuing our interesting talk with Dr. Sufiyan. Hello again.
Yes.
And
thank
you know,
so much
Abdullah,
for-
we were talking like about teaching and how it's kind of different experience than from working in the dentistry, of course. And I remember back in the days when I used to be an English teacher, one thing that I will emphasize on to my students is that do something that you really love and enjoy, something that driven a purpose, so you can leave a mark, you can leave a legacy. So, Dr. Sufyan, what one thing that you emphasize on when you are teaching your students?
Yes, teaching is a wonderful experience. I pour out everything and everything which I know, so that they learn as much as possible. And over a period of time, I want to be known in the dental community as a best teacher. Yes, so that and everybody wants to learn from me. It's not about the number of students, but
Quality.
the kind of a teaching which I give and the thing which they carry from me. So that's what matters, and looking forward to the rest of the life for training the young dentists as well through our
Awesome.
academy.
Really
Yes,
awesome.
Yeah,
yes.
and speaking about working with dentists and working with dentist students, and working with a lot of patients,
Yes.
what are some misconceptions about the field, or new students come, they have the wrong ideas about your kind of field?
Yes.
You know, would you like to enlighten us about
Yes, yes. See, what happens during a student life, universities and colleges, patients' flow is more. So they cannot spend much time with the patient. They come, this is what the treatment they need, and they get the treatment and go. But in our academy, what we teach is a limited number of participants and
Yeah.
limited number of people there, and we try to assign a patient to them so that they complete treatment from A to Z. So that experience is what we are giving, and we want to emphasize that in their private practice also in the future.
Yeah.
So the experience what they have in our training should be something unique and very close to the private practice. So and the number of patients they see should be is a less one than the compared to the college or universities what they give.
Yeah.
That's really cool.
Yes.
And I know, like you mentioned, that you want to be like number one, you know, and you have this motivation and driven, which is really amazing. And you're actually like right now like number one. And I know some people they try to do something extra. For so you, what is the extra that you try to do on daily basis?
Yeah, so I try to keep updated in my field or in other dentistry as well. So I try to be in touch with the advancements what is happening
Yeah.
in the dentistry and in the healthcare sector. So now everything is about technology. It is the things which I had studied in the college days is not the same thing which I'm teaching
Definitely.
now. So there are so many things which are coming up every day: artificial intelligence and technology, new equipments, and new softwares which are used in the dentistry. So all these things I'm trying to keep up to them, and I'm trying to implement in my practice also, and I'm trying to learn it through different ways. I go for trainings as well. I get trained and I train to the students and the young dentists.
Yeah. Because I think I saw, maybe it was this year or last year, where they had their first remote operation, where the doctor was like
Yes.
in the United States and they were working on someone
Yes,
for the
exactly.
robotics.
Robotics,
In
yes,
Europe, I
robotic
think, or something.
dentistry. Yes,
Yeah. Like
a
robotic
humanoid?
dentistry.
Yeah, like the robot, but they were controlling it all the way from another country.
He's doing like a
Yeah.
procedure.
Yeah,
Yes.
I think it was a
Okay.
heart surgery, but I was
Yes,
just
yes.
it just goes to show that technology in the medical field is
Yes.
advancing so rapidly.
Yes,
It's
exactly.
going along so
Exactly.
fast.
Before we had something called as telecommunication. Doctor was sitting somewhere far in the remote place. They used to call us. They used to call and have a consultation.
Yeah.
The doctor who is examining should tell some issues. They should be transferred there, and they will give some feedback, and that kind of a treatment was done. But now, as you said, the robotics has been improved. The
Yeah.
technology is improving. Doctor, we can sit here and control the joystick here, and then we can do the treatment in the remote place as well.
Yeah.
So
That's really
robotic
awesome.
dentistry is also upcoming now. They are into a research thing. So I think that will also come soon, and it will be in the practice as well. Yes, yes, yes.
That's
But
really
definitely, human is the one who is controlling the robot.
Yeah.
So definitely, it should be in a very good hands And
I mean, hopefully we never get to the stage where the robots are doing the
yeah,
operations.
yes,
This is,
yes.
yeah.
So any website we go, before it was like prove that you are a human. There will be a check mark.
Yeah.
Sure.
Prove that you are not a robot. But now robot is asking us, the technology is asking
yeah,
us,
you're
prove that
human.
you are a human. So we tick mark
Which
that
is
we
kind
are.
of funny.
Yes,
And
yes,
of course, you cannot talk about like robots development without talking about AI.
yes.
So how do you find like the implementation of AI in dentistry field?
Yes, AI. In the past, I think 3 or 4 years, it has taken over all the other things. So definitely, we have to accept that there is no. If you don't accept the AI in our dentistry, and we'll be left behind. Everybody is
Definitely.
going
Yeah.
ahead. Every clinic, be it a simple patient management software to a bigger softwares like planning softwares. Planning softwares are available. Just a scan. We don't use a paste also for the making the measurement of the teeth. Now we just take a videography, that's a scan, and there's no paste in the mouth and that hassle thing for the patient. So
Yeah.
once we do the scan and put it in the software guides us. This is a decayed tooth, this is the missing tooth, and these are the kind of treatment you can give.
Oh, interesting.
So even the X-rays we take, even the X-rays, once we develop the X-ray and you put it in the AI software, the software lists out even the minute decay can be found out through the X-ray
Give
nowadays.
you like
Yeah.
details.
Yes, very
Yeah.
much details based on the density of the bone, density of the tooth. All
Wow.
these things are coming
Yeah.
up. Yes.
Like I read an article a while ago that said AI detected maybe 96% correct diagnosis.
96.
Yeah, of all the symptoms they gave it. They gave it
Yes.
from all kind of
Correct.
medical fields,
Correct.
including dentistry, and they
Yes.
got it by 96
Yes.
correctness.
Yes, AI, artificial intelligence just works on a model where how much ever you feed the computer, the so much return you will get. So you feed 100 X-rays, it will combine all the 100 X-rays and gives us back the result. So there is no, and information is unlimited in the
Yeah.
cloud. So all the AI is taking up all the information there, processing it and
Yeah.
giving it back. We as a human, we cannot look into so many things, aspects as
Yeah.
well. Yes,
But it's an aiding tool.
yes.
Because a lot of
Yes,
people say
definitely,
no,
yes.
I don't want to use AI because of some reasons.
Yes.
But it's a tool, just like the computer, just like the
Yes,
laptop.
yes, yes.
It's a helpful
Definitely,
tool.
you should be the one who should control it, and you
Yeah.
should learn it, how best you can get use from that AI.
Yeah.
Yes.
And that's what's amazing about a human, that we are really adaptive and we can adapt with whatever like we have,
Whatever
new
the change
technology
we
and
are
every
getting. Yes.
Yeah.
any change, definitely. And
Yes.
talk about change. I know like from day to day people change, but after 5 years or 10 years, what's one thing that you would like to accomplish or you have in mind?
Yes. So um, uh, dental practice is what I am close with. I want to spend time more with the patients and give something. Even though I do 1 or 2 patients in a day, but I'm accomplishing that kind of happiness from the patient. I'm fine with it. This is kind of practice I'm thinking of, and teaching is what I want to take it forward. And I want to be more close to the students as well. Somebody who is not teaching them about some new things or advancement. This is I would like to be a pioneer for that. So inshallah, I think working towards that and hoping to get that
Yeah.
Inshallah.
as soon as possible. Yes.
I want to highlight your role as a dentist and as a teacher. And I want to ask you about the challenges of both. Like, what is so challenging with being a dentist, and then what is so challenging about being a teacher?
Yes. So both, as you said, both are challenging in their own way. In the private practice, it's like a patient is coming to you with some expectations, and we have to give that. And again, the finances is what comes into play in a
Yeah.
private practice. But in a student and a teacher relation, what matters is the education what we are giving. So definitely, the students they want to be related to the private practice as well. So the challenges what we face is the kind of a patients we deal with. So patients also has to be more compliant with us, and we definitely tell them that these are the training doctors and they are getting trained. But the challenges what we face there is the kind of a patient they don't want to be in the hands of a training doctor.
Yeah.
So this is what, but we try to manage the situation, and we are the guidance for them. So we make sure that nothing goes wrong, and no training is wrong for the patient. We try to give them as best as the private practice.
Yeah.
Sure, definitely.
Yes.
And talking about like challenges and overcome them, something that comes to my mind, like Michael Jordan.
Yeah.
Like he missed around 9,000 shots before he became like this great Michael Jordan.
Yes.
So it's
Yes.
all about like dealing with them,
Correct.
hardship, like that mindset that you have when you are approaching failure.
Yes, exactly.
So I know sometimes there were like some failures maybe.
Yes.
What is the mindset for those students who are watching us and they want,
Mhm.
when there's like an obstacle in front of
Mhm.
them, how do you deal like with the challenges, with failure?
Yes. See, challenges are part of our life, be it
Yeah.
studies or be it day-to-day life. So challenges are what we have to accept, and failures is what we have to learn from. So there's a saying, they say, learn from others' mistakes, because there is no time for you to make mistake and learn from it.
Love
Yeah.
it.
So just see where the people are doing that. That's what I teach my students also. Whatever the mistakes or shortcomings which I have faced, I don't want my students or the people who learn from me to do the same thing.
Yeah.
In my training, what we give in our academy, we try to show them as many challenges or shortcomings what can be faced. So this is what I look forward, and I think we will do it in a better way.
Yeah.
Yes.
And I want to ask you one final question,
Mhm.
and I really want to dig into this one
Yes.
because for a lot of people, they're afraid of going to the dentist,
Mm.
and for a lot of people, they're afraid of studying dentistry.
Mm.
What would you say is something that you should correct that with, you know?
Mm. See, definitely, dentistry. The word dentistry is more going to a dentist is more scary. Even I confess now that
Yeah.
even I am scared to sit on the chair.
Yeah.
Definitely, yes. So, so that's why I take care of my teeth very well. There should be no chance that I should be getting any treatment. But anyways, it's in the hand of a dentist how comfortable he makes the patient feel. It's not the dentistry which we used to do 15 or 20 years back.
Yeah.
We have newer technologies and newer materials, and the whole of the dental visit can be shortened with all these technologies if we implement in our practice. So I think most of the clinics nowadays have these recent technologies, and patients also, I think they should be accept the technologies, and I think they should be free mind and go ahead with the treatments.
Definitely.
Yes.
Very beautiful and very well said actually.
Yes.
And such an inspirational journey from someone who find his passion, pursuing it, overcoming all the obstacles, becoming the career that he really admired to be, and then taking that inspiration to other generations.
Yes.
What a legacy. Thank you, Dr. Sufiyan. It was really an amazing conversation with you. You inspired a lot of people,
Yes.
not only your students, but also the viewers who are watching us through this amazing episode.
Yes, thank you. You also that I could spend some time and share my views to you and the viewers. I'm sure they'll be useful with whatever I have said and whatever we have interacted here.
Definitely. Thank you
Yes.
so much.
Yes.
Yeah.
Was
Thank you
pleasure.
for that. Yeah. It was very educational. It was very insightful. But like you said, unfortunately, that was all the time we've had for this segment.
Yes.
But we're going to take a short break and we'll come right back.
Yes.
As with all good things, they must come to an end, unfortunately. That was all of the time we've had with Dr. Sufiyan, and I really, really admired how much he emphasized his role as a teacher as opposed to just being a dentist. He loved teaching students, he loved passing the knowledge, and basically just paying it backwards.
Definitely. From someone who found his calling and his purpose and take the passion to reach into his goal and being qualified to work in this career.
Yeah.
Then he wanted to inspire a lot of people around him by teaching them the craft.
Yeah, and I think he highlighted an important role is that, you got to give back, right? He said that he had great mentors while he was a student himself, and so he only feels like now it's his turn to pass on the torch and basically give the feedback back to where it
Definitely.
belongs.
And when you give back with love, with purpose, with knowledge, then you're gonna turn regular students into amazing people who can carry on this special legacy. So until next time, work on your purpose and continue to build your own legacy.